talking about kidney stones. So someone had asked a question about what to do about kidney problems. So one type of kidney problems that's very distressing to the patient is kidney stones. And when those stones form and then when they move such that they obstruct any part of the urinary system, the pain produced by that is exceedingly bad. In fact, it's not even tolerable. And most people say that, if it couldn't be stopped in some way by having the problem resolved or by strong pain medicine like morphine, that, they would, be really suicidal, actually. It's that severe of pain. It's caused by very severe smooth muscle spasm of the urinary tract, and it's always an emergency. The patient or the person cannot exist outside of the medical care setting. They have to be not only hydrated with good water, but they also need a lot of pain medication. And then sometimes they're going to need, if the stone cannot be passed naturally, they're going to need surgical invasive ways of removing that. So it's really a big deal. It's really a big problem. And the thing that's important to know is that the vast majority of kidney stones are actually preventable. And when people do have the most common type of kidney stone, it's called calcium oxalate. Calcium oxalate stones, those are largely preventable by having a plant-based diet, which is alkalinizing to the bloodstream and therefore alkalinizing to the urine, and does not allow the crystals to form and cause stones. So that is a very important way. Again, we had talked about the plant-based diet, that people can get their protein and their fats from the plant kingdom, and such as, just an example would be traditional diets of brown rice and beans, any kind of legumes or beans, or traditional corn, non-genetically modified traditional corn and beans. That's a perfect protein diet, and the corn or the rice plus the beans do not even have to be eaten at the same meal. Anytime during that day, the body matches up those amino acids and forms a perfect protein. It's anti-inflammatory, and it is alkalinizing. In other words, the end result in the bloodstream of finishing that digestion is alkaline, the opposite of acid. And that helps strong bones. It helps all the minerals that we eat from our plants, which is the source of minerals, to stay in bone and not to be coming out from bone and through the urine and then causing kidney stones. In those people that have kidney stone problems, they want to have an alkaline diet. So the less meat, the less meat products and dairy products, then the less acid production and the less stone formation. And the other thing that's very important for people with calcium oxalate stones is magnesium. Magnesium is safe for everyone to take other than people who have kidney failure, who don't need any extra salts. But magnesium citrate or magnesium glycinate are safe at the level of 500 milligrams per day, 4 or 5 or 600 milligrams in that range every day, and it does reduce the risk of calcium oxalate stones by 90%. That data was obtained decades ago, and since there's no money or pharmaceutical treatment involved in that, it may not have been always taught in medical school. But it's important to know that magnesium is a very good way of preventing and reducing the risk of these stones. So I hope that's helpful.
And speaking of kidney health, I've got to run to the restroom, so we'll see you in the next video. In the meantime, check out AuthenticHealthCoach.com for Dr. Candace Corson's top 5 nutrition tips. Have a great day, everyone.